All right, guys, welcome to my channel. Today I'm going to be talking about typhoid. Please, my name is Macaulay Chijoke, and I'm a registered nurse, a registered midwife, and many other things that are coming. But today, there's a reason I'm doing this video particularly because I found out that many people have typhoid. They don't know how to go about it. They keep on getting different medications, and then the typhoid, the organisms, keep on resisting. So today, the essence of this video is to tell you the medications that you need. It's very important. Let's assume you stay in a place where there is no doctor. You're staying in a very rural place. You don't know how to help, and someone is suffering from typhoid. What exactly are you going to do for the person? This is no longer about you being a health personnel. It's about you being present. So what exactly are you going to do? Now, I'm going to list for you 4 medications that you should have in mind that used to attack typhoid. Now, typhoid is caused by an organism called Salmonella enterico-typhi. What this organism does is that it gets into your body tissues, your body cells, and go and dwell there and start replicating. Do you understand? Now, some of you used to experience constant headache, every time headache, Sometimes you're experiencing back pain. You do everything you want to do, but this back pain are still there. Sometimes you ask yourself, what exactly is happening to me? Sometimes it's either is malaria or it is typhoid. And in most cases, some people used to make mistake in treating all these things. You see someone having typhoid, you don't even know that it's typhoid, you think it's malaria. Now let me give you a little difference between typhoid and malaria. That is based on the symptoms. Now if you start having malaria, for instance, check the back of your neck. For some people, the neck will start becoming very stiff. Their tongue will start coating. You begin to feel some bitter taste there in your tongue. Every little thing you're feeling weak. If you check your muscle, you look as if there is this kind of weakness, in your muscles. Yeah, it's what happens when you have malaria. In my next video, I will talk about the mechanisms. But in typhoid, you're going to see constant headache. You're going to see fever that persists for some time. Now, let's say you don't know what to do and you need a medication. You don't have money to go and start running tests in the hospital to do blood tests to know exactly the organisms, and then you want to take care of the typhoid in your own place. See the medications you're going to go for. Number 1 is azithromycin. Azithromycin is a macrolide, is an antibiotic. It targets gram-negative organisms or bacteria. Typhoid causing organism is a gram-negative organism. So when you give or when you use azithromycin on it, it's going to give you much effect. In short, globally, azithromycin is what is recommended. Yes. When it has not, gotten very severe to a point that the person will be hospitalized. Do you understand? Go for azithromycin. Somebody can ask me a question and say, why can't I go for cefizine or go for cefirozine? Those ones are good. Now, the second medication you should consider is cefizine. Cefizine is a cephalosporin. It's also an antibiotic anyway, but it's also a cephalosporin in 3rd generation. Cefizine works well because also it targets gram-negative. Now, the next drug you should consider also is ciprofloxacin. Ciprofloxacin is a drug that we all know very, very well. And is under, I think, fluoroquinolones. Yes, fluoroquinolones is where you see ciprofloxacin. It also helps to break down the works of this bacteria. And the last drug you should consider should be ceftriaxone. This is when this typhoid has gotten to a point that this person is hospitalized. Yes, you go to give IV or IM. It normally lasts for the IV normally lasts for like 30 minutes. Now, this is where you should come in. A situation where you go to a pharmacy, like me, let me use myself for instance. When I was having typhoid, I was devoid of the knowledge of all these things. But when I learned it, I decided to share. When I was having typhoid, I went to a pharmacist and I told him, sir, I need ceftriaxone because I learned that ceftriaxone particularly is very good to treating typhoid. So I said, give me ceftriaxone. The man just looked at me and gave me cefuroxime. Now, what they used to do there is that if you say this one is cefuroxime, they'll be like, it's still the same thing, it will do the same thing. It's a lie. Cefuroxime is a cephalosporin that is very good. But cefuroxime falls under second generation of cephalosporin. And any drug that is on second generation, the effect is lesser than the one that is on third generation. That is why cefizine is better than cefuroxime. Talk more of ceftriaxone. So when I went home, I took that drug for 5 days. Nothing happened. That cefuroxime is mainly for skin infection, UTI infection. There is a disease called Lyme disease. Is what is normally meant for. But when it comes to typhoid, it does not have that penetrating power to get to do where the organisms are resting. You know, to take them out. You get. So sometimes when you go to a pharmacist to buy medications, please, if you're a Nigerian, wherever you are, if you check these 3 or 4 medications I listed and they added something extra, I didn't say you should buy all of them at the same time, or like you buy maybe one and then augment it with your antihistamine, whatever, for malaria. Anyway, if you want to treat that. So if you check and you see any other drug, something like cefuroxime, there are so many other drugs that I cannot remember. Tell them you don't want those stuff because it's not going to work. No matter how they tell you that it's going to work, it will never work. I'm talking out of experience. Like I said, I am also a registered nurse, so I have a knowledge of what I'm telling you. So please, I hope you've learned a lot from this video. Please, I want you to like, comment, share this video. If you have any question, please ask me down there on the comment section. I am going to answer your question, so that this typhoid that is always giving you headache and you keep on taking paracetamol is not what paracetamol can cure. Paracetamol is an analgesic, so you just start getting pain, but it's not going to kill any microorganism. So I believe that you've learned a lot from this video. Thank you very much. Please don't forget to like, share, comment, and then ask me your questions. Okay, thank you guys.